One of my favorite techniques just to warm the wrist up before mobilizing, cool the wrist down after mobilizing, using this as a pain reliever is a row technique where we're guiding the gliding during either extension or flexion movement pattern of the wrist. So what we're going to do is we're going to use our little finger in the ulnar side of our hand. In this instance, we're going to be working on extension or cooling down extension. And what I love about this technique is the arm can hang. I've got the proximal row under my little finger. I'm going to stabilize the radius. And what I'm going to do is, if I want to, I can give a little bit of traction, and I can glide a volar glide of the proximal row while bringing the wrist into extension, ulnar deviation, and a little bit of pronation. So that nice little pull kind of gives a little fascial stretch. It unloads the joint. Okay, and again, your patient can help you very gently. Good, you can do that a few times, and you can do the stop and hold. Don't let me push. Now pull down and pull up again. Very good. It's just a global way to work on wrist extension. Flexion, I'm going to change my hands, now using the ulnar side of my right hand, working with the right hand, stabilize the radius, and now what I'm going to do is I'm going to do a dorsal glide of the proximal row by simply lifting the ulnar side of my hand. I can also give a little bit of a push with volar with the radius to guide the glide motion. So a little bit of separation, roll the proximal row over my little finger, give a little bit of proximal or volar glide at the radius, and here again, a nice gentle movement. We're going to go into flexion, ulnar deviation, and a little bit of supination. And then we ask our patients to help. Good, come with me. I always say about a 2 out of 10. We're not arm wrestling. Good, do that a few times, and then I'll say hold there. Okay, don't let me pull up. Now pull up and pull down again and relax. Very good. Now, about now we can ask our patient how they're feeling, and we can even have them recheck their motions to see if we have gained mobility. So we'll have you turn a little bit towards the camera. There we go. And we'll do a little check. Have we gained? And sure enough, it appears to me like we have. Actually, elbow is higher on the right side. Range is about the same. Very good. And try the other way. Good. And drop down. Good. So we've done a great job of restoring mobility in this wrist, and you will too in your clinical setting.